Hello and good evening, and thank you for joining us to the Functional Solution Podcast. My name is Tal from the American Academy of Functional Health, and we have with us today Dr. Chill.
Hi, everybody. Welcome.
And Dr. Chill and I come together to join forces together to bring to you the most recent studies and the most recent pathways and mechanisms in functional medicine. And really, the focus of our discussion today is going to bring you the most important focus on the root causes of chronic conditions with the most important pathways and mechanisms and treatment strategies, so you can help your community members and your patients to improve their health, transform their lives. And today we got an especially important topic, because we're going to talk about adrenal health and chronic diseases. And this is one of the hidden causes of chronic disease, because it contributes to so many chronic conditions, from joint pain and inflammation to anxiety and depression and chronic fatigue. And unfortunately, I refer to it as the hidden cause of chronic diseases because it is not addressed almost at all in the standard of care. And doctors don't talk about it. They don't properly test for it. And as a result, so many patients out there continue to struggle. And so once we have learned about some of these mechanisms and pathways that we're going to talk about today, and we made the appropriate treatment recommendations to the patients, we're able to transform some of our patients' lives. And once you learn this material, learn it really well, the pathways, the diagnosis, and the treatment strategies, you can make a significant difference in your patient's quality of life. And this is something that I've noticed over years of clinical practice with myself and my team members. And Dr. Chill, being a functional medicine physician, has been using the same functional approach for years, helping his patients with multiple conditions. And Dr. Chill, what was your how did learning adrenal about the whole topic of this subclinical adrenal insufficiency, how did that change your results?
I mean, it's one of the biggest needle drivers, right, for health. A lot of people miss this spot. And I'm glad that you brought that up, that a lot of doctors don't discuss this part, right? But it is actually really important to look into adrenal health when you are working with chronic stress-related conditions, which we will be diving into what that might look like, how they might present to your office. So when you might want to assess adrenal function in your patients. So I'm really glad that we're doing and covering this topic, because in functional medicine, this is used all of the time, and this is going to be one of the biggest needle drivers in health for your patients. So this is going to be extremely helpful in addressing some of the root causes for your patients, and then also getting your patients to where they want to go in their health goals and even optimizing their health for them.
Absolutely. And this was, I can share from a personal point of view, as a young child, being diagnosed at the age of 6 with different putting on different prescriptions for asthma, and later on chronic joint pain, and then steroids and all that stuff, which messed me up completely within about 10 years of using all those drugs. And learning about adrenal function is something that obviously all healthcare practitioners go through, but learning about it from a functional medicine perspective and doing the tests and running myself through the treatment strategies and protocols have completely changed my health. And this is where it was a big eye-opening for me after being, jumping around from one doctor and one specialist to the other for several years and trying different things. This is one of those factors from functional medicine approach but completely transformed my own health. And so today we're sharing this with you because we want you to use the same principles, the same physiological principles to change your patient's health when you see those signs and symptoms that we're going to talk about today. So we're going to start with the basics, right? I'm going to take you back to Physiology 101 just for a couple of minutes. Don't stress about it too much, just for a couple of minutes. But in this picture that you're seeing right now, we have the adrenal glands, right? So they sit above the kidneys. They secrete multiple types of hormones into the bloodstream. And there are two parts to the adrenal glands, which are the cortex and the medulla. Each produce different hormones, right? So the medulla is the inner part. And you can see the adrenal glands in this picture, marked as purple, in the purple color. And the inside of it, the medulla, is secreting epinephrine and noradrenaline, which is, we know them as the fight or flight hormones. They also play a role in blood pressure regulation, heart rates, and attention. And then on the cortex of the outer part of the adrenal, we have the production of aldosterone, androgens, and cortisol. And for our discussion today, we're going to talk about cortisol, because that's one of the major drivers that we're seeing that play a role in this adrenal dysregulation or insufficiency and chronic conditions. So just as an overview, what stimulates the adrenals is the hypothalamus and pituitary. That's what we refer to is the hypothalamus pituitary adrenal axis, and it regulates the production and secretion of cortisol. And of course, we're going to refer to the hypothalamus pituitary and adrenal axis as the HPA axis. The HPA axis is essential for homeostasis in the body and deals primarily with stress response, energy metabolism, immune function, and neuropsychiatric function. So knowing and understanding the roles of the HPA axis, you can start thinking about what type of conditions could be related to this dysfunctional HPA axis, right? You can have problems with stress response. You can have problems or symptoms of energy metabolism. You can have symptoms of immune dysregulation or inflammation, and you can have symptoms that are related to neuropsychiatric function or neurological function, or let's call it neurotransmitter imbalance, right? So, Dr. Chill, take us into the role and the function of the HPA axis, so we'll get a better idea as a reminder how this axis work.
Yeah, absolutely. So let's take a look at this whole system, from the hypothalamus to the pituitary to the adrenal function. And the best way to do that is just to show you an image. So we'll pop up an image here for you to take a look at. So we can see on the top here, the hypothalamus, right? So that is a major component to releasing CRF, which is going to stimulate the release of hormones that produce morphine-like effects. This is going to create a cascade that stimulates cells of the adrenal glands, which we see on the bottom there. And this is going to produce and release the stress hormone, cortisol. And then when cortisol levels reach a certain level, it's the or the CRF that's produced in the hypothalamus, and the ACTH, which is produced from the pituitary gland. Those releases will diminish. The reason why this is important, because when we are stressed, right, and now we understand that from all the research that's out there, chronic stress levels can lead to a lot of chronic conditions. So every time we are stressed, what happens is it activates this HPA axis that we're seeing here. And the issue comes when we have chronic stress, and this HPA axis is chronically stimulated, which chronically secretes cortisol. why that is important. So here are some of the roles of cortisol. It's responsible for our stress response because it helps to manage the stress and respond to things like danger. But if this goes off balance because of the excessive stress response, that stress response can be diminished. Blood sugar levels. Cortisol is regulating blood sugar levels because it can maintain our blood sugar by converting lactate, pyruvate, glycerol, which is the fats, and then certain amino acids and proteins to glucose. And if that is dysregulated, our blood sugars can be dysregulated. Inflammation. Cortisol has usually an anti-inflammatory response, but the chronic elevations of cortisol can actually lead to your immune system becoming resistant to cortisol, causing a pro-inflammatory response. Cortisol is also responsible, and this whole HPA axis system is also responsible for blood sugar and blood pressure and maintaining that blood pressure. The immune system is another system that this HPA axis is responsible for. The cortisol can contribute to the workings of the immune system. So this is why this is so important in functional medicine, to understand how this HPA axis functions and what it can do to our other systems, such as our stress response, our blood sugar, our inflammatory responses, our blood pressure, and even our immune system.
Absolutely. This is one of the essentials that we have when we talk about the endocrine, how the endocrine system, a dysfunction in the endocrine system can lead to chronic diseases or chronic symptoms that most of those patients that struggle with, they might jump from one doctor to another, one practitioner to another, and that some of these practitioners don't know what to do with them.
Absolutely.
So
this is one of those missing pieces that practitioners often forget, unless you're studying functional medicine. And
exactly.
once you get this missing piece, you really get to help those patients out, and you're getting to some of the root causes, right? And then you're solving that missing piece, which helps them get to their health goals.
Yes, absolutely. And so we're going to dive a little bit deeper in terms of how does this dysfunctional response is actually leading to chronic diseases. So we got to think about a patient that is struggling with chronic stress. We already mentioned that stress activates the HPA axis and leads to secretion of cortisol. What if your patient has went through a traumatic event, either emotional or physical, like an injury or motor vehicle accident or anything like that? What if they are under mild chronic stress? They got strenuous deadlines, they got very strict deadlines at work, they got family issues, whatever it is, and they're going through stress. They're on a fight or flight response for a long time. Think about the overproduction of cortisol. There are interesting reports that show that physiologically, that overproduction of cortisol would lead to a growth of the adrenal mass that will take time to recover. There's several phases to recovery. And some patients with excess or chronic stress, it might lead to the disruption of healthy function of the HPA axis. Essentially, next time that the patient needs to produce and secrete cortisol, they will have less cortisol available to them. And that could lead, less cortisol secretion can lead to lower blood sugar levels. Because as Dr. Chill mentioned, when cortisol increases, we have gluconeogenesis in the liver, which means that our liver starts releasing more available glucose in our blood. Our brain needs constant supply of glucose. If our glucose reduces, how do we feel? We feel tired, we feel foggy, it's hard to concentrate, right? When we have sufficient amount of glucose, right, we feel better, we feel more alert. So with the lower production of cortisol comes, for many patients, feeling fatigue, feeling tired. Also, cortisol is and very strong anti-inflammatory compound. Think about the cortisone injections that were given patients into their joints to reduce inflammation, right? So our adrenal produce a very important metabolite that reduces inflammation. That's cortisol, right? So your first two major symptoms to identify adrenal insufficiency is fatigue and or chronic inflammation. So when we think about chronic inflammation, obviously we mentioned joint pain. That's a classical example of inflammation in the joints causing pain. But let's take another example that we might not think about from the field of internal medicine, and that is asthma. There is a really interesting study conducted in Cape Town, South Africa, and the authors evaluated the function of the HPA axis in 143 asthmatic children that were taking steroids. And what they found was, the researcher found that 65% of those asthma patients had HPA axis dysfunction. The study also showed something to the measures of about 30% of them had also adrenal insufficiency. And so if you want to read more about this particular study, it was published in 2008. It's called the Hypothalamic Pituitary Adrenal Axis in Asthmatic Children. And it's important to remember that under normal conditions, this is another factor we have to consider. Under normal condition, cortisol binds to glucocorticoid receptors and acts as an anti-inflammatory agent. If the patient has prolonged or excessive cortisol secretion, another theory states that it might result in downregulation or resistance to the glucocorticoid receptors that will essentially block the binding of cortisol to the receptor, which is very similar to the mechanism that we see in insulin resistance in diabetes. So we also have to think about, if the patient constantly secretes more cortisol, the body will adjust and reduce the response of the receptors, right? So those are the two mechanisms that we want to think about when we have a patient with a condition that inflammation plays a significant role in, right? And so this is where we're going to start talking about the two different types of adrenal dysfunction. And this is something that, unfortunately, I went through 3 different functional medicine programs. I'm not going to mention the names. They were good programs, but they haven't really dived into this very, very important topic, despite the fact that I spent thousands of dollars. One of these programs were $20,000. The other one was $35,000. And they really didn't dive deeper into really understanding this topic. Not only that, but they refer to it as adrenal insufficiency. But the reality of it is that there are 2 types of adrenal insufficiency, and they are very, very different. We're going to show you what the lab testing looks like. I'm going to show you a few pictures of the lab testing in a few minutes. But it's really important as a practitioners to understand the 2 differences, because the treatment strategies are completely different for those 2 types of adrenal dysfunction. So Dr. Chill, take us into the first type of adrenal condition, functional adrenal condition, and what does it look like? What's the pathway? And we'll talk a little bit also about what we might need to do when we have that situation.
Yeah, and I'm glad we're bringing this up as well, because there are a couple of different ways to look at adrenal imbalances, right? And there's 2 different forms of these adrenal imbalances. And as Dr. Cohen was saying, it's really important to decipher between the differences of these 2. And the first one is going to be what's called subclinical adrenal insufficiency. Insufficiency is the key term here in this specific form of adrenal condition. This occurs with emotional, psychological factors, including stress anxiety, depression. This can disrupt our sleep patterns, and then it can make it challenging for people to relax, to fall asleep, to stay asleep. And it's because of these chronic stress factors that are activating chronically that HPA axis that we saw earlier in the image there. And that is causing an abnormal cortisol secretion. And this is going to continue to disrupt the sleep wake cycle. And it is all of these stress factors, right, that I mentioned: the anxiety, the depression, the chronic stress, the disrupted sleep patterns, that can create many pre-existing endocrine disorders, such as an adrenal crisis or even a thyroid storm. So it's really important to understand this factor when you are working with the endocrine system, such as the thyroid or even sex hormones, because they all have an interplay. They all correlate with each other. So with most patients, the chronic stress is going to overactivate or abuse the HPA axis that we saw, that can lead to the subclinical adrenal insufficiency. So these are your patients that are chronically stressed. So in other words, it's going to lead to a response to stress with a lower secretion of cortisol. So that hyperactivation, that chronic stress that is overexerting the HPA axis, is going to cause a lower secretion of cortisol. And remember that cortisol is really important, as it maintains our healthy blood sugar levels, reduces inflammation. And so if we're not having enough of that cortisol response because of the chronic stress, those systems, the inflammatory system, the blood sugar systems, aren't working as well. So these patients might feel really tired, very burnt out. They might have symptoms like anxiety and depression, which I mentioned before. And you can read a little bit more about this called, there's an article called How Stress Impacts the Endocrine System, Stress and Hormones. And this was published in the Indian Journal of Endocrinology and Metabolism in 2011. So with these types of patients, it's important to ask them what their stress levels are, if they experience any stressful events before their conditions and symptoms started. And then for these types of patients, right, they are having trouble falling asleep. They might be having anxiety and depression. They're feeling that tired all of the time, that burnout. It's important for them to do some stress management techniques a few minutes every day, such as taking a walk a few minutes every day, or even reading a book. And that should occur on a daily basis for them to help them with that cortisol response. There are also some nutraceutical and herbal compounds that can also increase their cortisol production. And we will actually talk about that in more detail in the specific treatment protocols. And this is going to be in the advanced and clinical functional medicine program. And with that stated, what does this look like when you test, right? So let's show a picture of what this looks like and how we're testing this. So the first test that we're looking at is the saliva cortisol times 4, or just a cortisol times 4. It's a comprehensive adrenal function. One that you can use, or one company that you can use, is Doctor's Data. Another one is Dutch that you can use. So in this picture, we see here that they have insufficient levels of cortisol. It should actually be in the green. So you can see it below the green. So how your cortisol response should occur within the green is that the cortisol levels should go up in the morning and then starts to decrease throughout the day while staying in the green. If you have adrenal insufficiency, right, through the chronic stress response, it's overacting the HPA axis, leading to a lower secretion of adrenal. This is what it looks like on a lab result. It is under the green, so they're not producing enough cortisol. How does this test work? It's actually extremely easy for your patients to do. It's a saliva sample. It's taken 4 times throughout the day. It measures cortisol 4 times throughout the day, along with DHEA. This is important because typically when you're doing a standard lab test, they're just doing an AM cortisol, right? So that's only giving a snapshot of the cortisol in the morning. This is a more comprehensive look at your adrenal function because it's measuring those cortisol levels throughout the day. And it's really simple for them to do. As I was stating, it's a saliva sample, and they're pretty much spitting in a tube 4 times throughout the day. And when you're given the lab kit, those directions will come with that. So it's pretty easy for the patients to follow. Now, as I mentioned, some of the symptoms that you will see with adrenal insufficiency, this is when you should be measuring these cortisol levels for your patients, are chronic fatigue, low energy levels, if they have a hard time or a difficult time handling stress, right? So stressors that might be a normal response for people, they have a difficult time handling those normal stress responses, and they might have sleep disturbances. This is going to be a really important test for patients that have issues with staying asleep or even falling asleep as well.
So, Dr. Chill, I'm so glad that you mentioned about subclinical adrenal insufficiency, and it's such an important concept in functional medicine. And I wanted to touch base a little bit about sort of like the difference between the functional approach to adrenal insufficiency and the medical approach, because I know that saying, and this is where we're getting into the lines, sort of like the gray line between the conventional approach, standard of care, and how we look at things from functional medicine. And this is why I wanted to mention, one, what's the difference between adrenal insufficiency or subclinical adrenal insufficiency and functional adrenal insufficiency, which is what you were just mentioning. And also, what's the difference between that and Addison's disease, right? For so many of our community members who are trained in the primary care realm. So we'll start with Addison disease because might be a little bit more straightforward to talk about. So Addison disease is essentially a condition in which, as we know, it's an autoimmune disorder in which the immune system attacks the adrenal glands, damaging the adrenal cortex, and this condition is managed typically by endocrinologists, right? And we can see a significant reduction in cortisol. We can also see the elevated levels of antibodies. Now, when we talk about the mainstream approach in terms of the difference between subclinical adrenal insufficiency and functional medicine adrenal insufficiency, in the mainstream approach, subclinical adrenal insufficiency is when the adrenal autoimmune condition, or what we call autoantibodies, right, are found in people that don't yet have the clinical signs of adrenal insufficiency, right? In comparison to that, in functional medicine approach, this is what we call functional adrenal insufficiency. We might not see adrenal antibodies because the cause might be chronic stress, the cause might be nutritional deficiencies. There are several causes that could lead to that, what we call functional adrenal insufficiency. And so I just wanted to clarify that so it's not going to get confused, right? Especially if you approach another medical practitioners who are not trained in functional medicine and you say this patient has subclinical adrenal insufficiency, they're most likely going to think that you are referring to an adrenal autoimmune condition and the patient does not have yet the signs of adrenal insufficiency. Well, in the functional approach, what we actually mean is that we don't mean that the patient has adrenal antibodies. We mean that the adrenal simply, for whatever reason that is, the adrenal does not produce the same amount of cortisol for whatever reason. Again, maybe a dysfunctional adrenal response, maybe a dysfunctional HPA axis, maybe lack of certain nutrients that are essential for adrenal, such as vitamin C, right? We're not going to dive into all of those factors now because we have a whole class just specifically designated into talking about the adrenal. And there's a lot of pathways and treatment strategies that we can talk about. But essentially, just remember that. Now, the second, Dr. Chill talks about the functional subclinical adrenal insufficiency. What we want to talk about is factor number 2. This is functional adrenal condition number 2, which is adrenal dysregulation. So, while Dr. Chill talked about the lower impact of lower secretion of cortisol, one thing that you do not hear in most functional medicine programs, I know because I went through 3 different programs and they did not talk about this, is another type of adrenal problem, and that's dysregulation, which means that the patient might be secreting cortisol at normal physiological levels or above normal physiological levels, but it's secreting it in the wrong time. So just to give you an idea of what that could cause, right, physiologically in our body, we're going to look at the impact of excess cortisol with patients that have Cushing disease, which is, again, an autoimmune condition that has too much cortisol that is secreted. So let's take a look at this picture, because, again, one picture is worth 1,000 words. And you can see here on the top left that excess secretion of cortisol contribute to obesity. Why? Because we have gluconeogenesis in the liver that leads to excess cortisol, right? It also, on the top right side, you have protein catabolism. You have glucose uptake. So the muscles don't take as much glucose, right? You lose muscle mass, which damages your metabolism, reduces your resting metabolic rate, right? On the left side, you can see the gluconeogenesis, which means that you're producing more glucose, which contributes to insulin resistance. On the bottom right side, you can see the impact of excess cortisol on the pancreatic cells. So you got a decrease in the function of beta cells because cortisol deteriorates beta cell function by reducing the GLP-1 production, and it impacts insulin secretion, eventually leading to negative impact on the insulin gene transcription and insulin secretion. So if your patient's secretion is over-secreting cortisol in the wrong time, this is what we call adrenal dysregulation. It can impact multiple conditions, right? So let's think about, for example, and we can get off this picture. So let's think about, for example, cortisol and HPA axis, right? You get the patient has suddenly secretion of cortisol. That stimulates the gluconeogenesis in the liver, and you get glucose synthesis, right? You get higher elevation of glucose levels in the bloodstream. That excess glucose, right, is now getting into the liver where it's converted into triglycerides, right? So now you have a state of hyperlipidemia if it's chronically happening, right? And not only that, but that excess triglycerides is now stored in the adipose tissue and enlarges the fat tissue, right? So you also have contribution to the weight gain, right? So you got hyperlipidemia, contributes to hyperlipidemia, contributes to weight gain. Now let's talk about chronic conditions, metabolic conditions, right? There is a significant association between excess of cortisol and also diabetes type 2. So there's an interesting study. They took 140 diabetic patients and 280 healthy individuals, and they found 2 interesting things. One, flattening of the diurnal cortisol curve was reported to be associated with insulin resistance and type 2 diabetes. So if the patient has dysregulation in the secretion of cortisol, then that is associated with insulin resistance. But what's most importantly they found is that salivary cortisol output was 36% higher in diabetic patient compared to control groups, with significant differences in cortisol levels at waking, at 4 p.m., and at 8 p.m. And this is something that we have seen with another study that was published by the American Diabetes Association that showed that if your patient had a significant elevation of the cortisol levels at nighttime, what will happen is their glucose level might increase, right? So if you want to read more about it, this is an interesting study that's called The Disruption of Multisystem Responses to Stress in Type 2 Diabetes. You can read it here. It was published in 2014. There are other additional studies that were looked at. But essentially, this is what it would look like in the lab testing. If you use the right test and you measure it appropriately, this particular picture was taken from doctor's data adrenal profile test. And you can see here that you got the green phase, the green area, that's the optimal range, right? So we don't want cortisol levels to be too high. We don't want it to be too low, right? In adrenal dysregulation, the cortisol levels, instead of remaining low and getting lower in the evening, right? We don't want high cortisol in the evening because our body is preparing for sleep, right? So remember that cortisol is antagonist to melatonin, and we talk a lot more into it when we have the class on sleep optimization. But if suddenly the patient is sitting there on their sofa, right, their diet is well managed, they have diabetes type 2, and they're just, they're trying to better manage their diabetes. They see a dietitian, they get them metformin, they're managed, but suddenly they get a spike of cortisol. That would lead to what you see here in the graph, to an elevation in cortisol levels, which would elevate also their glucose levels. They don't have to eat sweets for that. They don't have to eat carbs for that. It is internally produced. So this is what we call adrenal dysregulation. Depending, of course, on the level of dysregulation, you can have a mild increase, like we see here on the black line, or you can have a significant increase like we see in the red line. Why is that important? Because if you have elevated levels of cortisol, they're going to have more sugar in the blood. It's hard to sleep when you have elevated cortisol, because cortisol would also reduce your level of melatonin. It would prevent your body, in fact, from producing melatonin. So this is why it's important. If your patient have sleep disturbances, if they have diabetes, glucose metabolic dysfunction, if they have weight gain, there are multiple conditions that are associated with adrenal dysregulation. And this is something that unfortunately is not taught in other functional medicine programs. But we teach it. We teach it in depth, and we teach it specifically what are the strategies you can use to help your patient. So to learn more about this, I would recommend you to go in to the advanced functional medicine program and look into the specialty classes of what we call adrenal dysfunction and dysregulation. You're going to learn a lot more, and we actually have some really cool case studies that we look into when we talk about that. So this is where you learn about, kind of to summarize it, we talked about two major important factors when it comes to adrenal function. One is the functional adrenal insufficiency. The other one is the functional adrenal dysregulation. They're both very different, and learning how to identify each one of them in your patients, start with understanding the pathway, invest in some time and effort to learn the lab testing and the proper treatment strategies. And that can make a massive difference in your patient's experience and your patient's quality of life. And that's why they're coming to see you, right? They're coming to see you because you have an ultimate edge, an ultimate advantage over other practitioners who have not learned functional medicine and do not know what to do with those patients. So now that we talked about the functional medicine approach, Dr. Chill is going to take us into some of the techniques that we want to use when we are when we are working with a patient that have challenges with functional adrenal issues.
Yes, so that's right. So now we understand that chronic stress can lead to adrenal insufficiency or adrenal dysregulation. So I want to be able to provide my patients and with some simple techniques, right? So here are some of the simple techniques that you can recommend to your patients and your clients as well. The first one for reducing stress is actually just going for a walk. This could be after lunch, after dinner. It should be about 10 to 15 minutes. Research has shown that even going for a walk for about 7 minutes or 10 minutes can reduce enough stress to balance out those cortisol levels. Again, it's 7 to 10 minutes. I would even go for 15 minutes if you're able to, but start small. Start with 5 to 7 minutes for your patients, go to 10 minutes after a couple of weeks, then they can go into 15 minutes of a walk after a lunchtime or dinner time to help with balancing out their cortisol levels. The other easy stress reduction technique that I like to explain to my patients is the 5 breath count. This is taking a deep breath for a count of 5, holding it for a count of 5, and exhaling for a count of 5 for a total of 5 times. So that's why it's called the 5 breath techniques. Again, that is inhaling for 5 counts, holding it for 5 counts, exhaling for 5 counts for a total of 5 times. And this has been shown to reduce stress, decrease or balance cortisol levels. So it's actually been shown to decrease cortisol levels if they've actually have excessive cortisol levels. This deals with the adrenal dysregulation. If they're too low of cortisol levels, it actually has been shown to balance out those cortisol levels for them. So those are some simple, easy stress reduction techniques that you can recommend to your patients. Another one we want to go into is going to be more of a nutraceutical or a supplement. Ashwagandha is a supplement that you could recommend for balancing out cortisol levels or modulating cortisol levels and modulating the stress response for patients. Ashwagandha is also called withania, and this is an Ayurvedic herb that is used for fatigue, adrenal insufficiency, and even pain management. It's going to contain several active ingredients, including withanolides, withaferins, and saponins. The dosage recommendation is 250 milligrams per day and up to 600 milligrams per day for up to 60 days. And this has been shown to significantly reduce perceived stress levels and serum cortisol levels. And that has also been shown to improve the quality of sleep. And if you want to read about that herb, there is a article called Adaptogenic and Anxiolytic Effects of Ashwagandha Root Extract in Healthy Adults. And this was a double-blind, randomized, placebo-controlled clinical study. And this was published in Sirius in 2019.
Beautiful. And that's kind of concludes our session with learning about some of the pathways that helps us to understand that when a patient comes to see us and they have metabolic conditions, chronic fatigue, chronic inflammatory conditions, joint pain, and other internal conditions that are chronic and inflammatory, now we have a better understanding of another one of those major players that can contribute to those. And unfortunately, in primary care and a mainstream approach, we have categorized and basically disassemble the body into completely separate parts, right? So patient has joint pain, ongoing joint pain, they go to see an orthopedic doc, right? That does not look at how the endocrine system plays a role with their joint pain, or they don't look how the gut plays a role in that inflammatory pathway, or they don't look at the role of environmental factors or other internal factors, right? So this is where learning functional medicine creates an amazing understanding of the body as a whole, because it allows us to really understand how the endocrine system impacts all the other system, and then the gut, and then the environment and our diet. And it helps us to understand the specialty lab testing, what we call functional medicine labs, and also to understand the very straightforward, clinically applicable treatment strategies that you can just choose one or two of them. And we have seen how they can completely transform someone's experience and quality of life. So that's something that is really important to mention. And as usual, if you enjoy this, then we invite you to continue in the functional medicine, the advanced and clinical functional medicine program that we have. It's on demand 24/7, and our community members are all enjoying it very much. So it's learning on your own time, on your own pace, and it's a great experience because we're very focused on the clinical application. There's a lot of case studies. It's just an awesome. We got amazing feedback on it, and of course, Dr. Chill, you're working with our community members also one-on-one in the Quick Start program. So this is where you get 12 to 20 minutes mini classes. You can watch it on your phone or in your computer, and for about a week or two, you kind of go over the entire system, and then you learn how to use the evaluation form, which tells us as practitioners in like 2 to 3 seconds, 2 to 3 minutes, what is the root causes that we want to focus on. So, and then we give you the clinical guide. So we have seen some of our practitioners use this form, within 2 to 3 weeks of joining the community. They go on a session with you, Dr. Chill, and they get to learn through experience in functional medicine rather than just watching a class. They get to learn through experience and through filling it out themselves, right? So what was the experience, Dr. Chill? What was some of the experience or feedback that you've been getting from physicians, nurse practitioners, and pharmacists, other professionals?
I think the biggest thing is because there's so many different areas of functional medicine that you can go to, a lot of practitioners have a hard time figuring out where to start, right? What are we prioritizing here? Because there's so many underlying factors. There's so many possible root causes that we want to investigate. And the whole point of the Functional Medicine Quick Start program is to be able to utilize the resources that you have within that program, such as the Functional Medicine Survey, so you can use that as a guide to determine and prioritize which areas you want to assess first for your patients, because it's going to break it down into the most priority areas for you to look into for them. And this is going to help guide you into figuring out which lab tests to do first, instead of doing all of the lab tests. A lot of patients can't afford all of the lab tests. So what are the major 1, 2, or 3 lab tests that you can do for them? And that functional medicine survey will help guide you into doing that. And so in the coaching calls, what we do is we either have the practitioners fill it out for themselves. They might have family members that are interested in the functional medicine approach, or they might already have patients that are wanting to use functional medicine, and then they can fill that out. We go through the functional medicine health survey together. I teach them how to look at it, how to use it to prioritize and what to investigate and what to assess first, and how to use that to prioritize their labs and even prioritize their treatment approaches by utilizing another resource for them, which is the Functional Medicine Quick Start Guide that goes into the major areas of functional medicine. It goes into the biomechanics, the treatment approaches, the different labs, and then how to assess and evaluate it. So we really go through the different resources and how to utilize them in a clinical setting, so they can start to apply functional medicine right away.
Yes, and I love that approach. I can share from personal experience that I've used it on myself, and I actually found a few things that there's a few things that I knew about the way my body functions, and there's a few things that I did not think about consciously, and it really helped to identify it. And where it really shined for me, it took us about 5 to 6 years to develop this powerful tool with the help of several experts in functional medicine. And it was so valuable. And the first few folks that I started using it are patients that we used to see that had a very low budget, or didn't have insurance, and we couldn't order the functional labs because they didn't have insurance, or they were on a very small budget. And I said, listen, we got this powerful tool, and how about you fill it up? Come see me next time. I'll give you a couple of recommendations, 2 or 3 strategies and recommendations right now. So at least, you're going to get yourself better instead of down the disease pathway and get worse. And come see me, fill it up, come see me in 2 or 3 weeks, and we'll go over it together, right? And I'll never forget, it was one particular lady that came in. She was on disability, was not working for several years, a lot of pain, a lot of inflammatory, a lot of metabolic issues, right? And she really didn't have a lot of money. She had a little bit of money for supplements, 1 or 2 supplements that we kind of picked. And then she had a little bit left for paying for the sessions, right? And I said, listen, let's take the form, fill it up. It doesn't cost anything. And I'm giving it to you. Use it. Come back. We'll go over it. And I'll never forget, she came back. One, she was so excited because she said, listen, like I got so much clarity just by filling up this form and looking at the different categories and where I have, more symptoms of that and less symptoms of this. And I was like, it brings so much awareness to what's happening in my body. And I looked at it within a couple of minutes, 2 or 3 minutes. I was like, okay, this is like, I can clearly now see what are the 2 major things that we need to work on. So my recommendation would be is one way to do it is we can focus on the 2 major things that we see in this functional evaluation screening tool. And then I'll meet up with you in 3 to 4 weeks. Give me your feedback, right? And she said, that works well. And I said, listen, functional medicine labs are amazing, but I know that we're on a limited budget. So let's do whatever we can. I'll just go straight for the recommendations. And if I'm right, then it's going to be a win-win situation. You're going to feel better. I knew that I was right. If I'm wrong, we can always go in a different direction or order the specific labs that we have more data, right? We can wait until, we'll get, you'll be capable financially to order some of those labs. And she came back a month later and the results were incredible. She said, I have more energy. I have less pain. I have this, right? So it was just a month, right? But even those small improvements gave her hope again that there is a way to improve and restore her health, right? And I continued to work with her. I worked with her for another 4 or 5 months. We got some pretty significant changes in her health. And then I educated her about how to continue to take care of herself. And it was amazing learning experience for myself. So that form, from that point, moving forward, we started using it in our practice. We teach our other team members, the physicians, the nurse practitioner, the nutritionist, the acupuncturist. We trained them all in functional medicine. We taught them how to use that form. And it was incredible success. So instead of running straight into the functional labs, like you typically done in other functional medicine clinics, we actually save our patients a lot of money by talking to them and identifying the root causes before we even get to the labs, right? And of course, we want to use labs when appropriate because we get a lot of very important data that we otherwise won't have access to. But using those tools are very powerful. And I would personally recommend to, each one of you to go through the Quick Start program. You get it as a gift from us. This is a $1,500 program. You get it as a gift from us when you join the Advanced in Clinical Functional Medicine program. Dr. Chill is actually going to work with you one-on-one to make sure that you understand how to use those tools, show you examples and all of that. It's an awesome experience. So Dr. Chill, thank you for putting all of this together and sharing your experience.
Pleasure. Absolutely.
And for working with our community members to help them to get straight into functional medicine, like offer it right away to those chronic patients that, they're struggling every day. So why wait, So that's what I love about this amazing program. So, and I want to thank all of you for being here, for taking the time to advance your skills, learn more about functional medicine, and learn the treatment strategies that can change your patients' lives. So that's what we're all about. We're really all about making a significant impact in every person that walks into your practice. So I want to thank you for being here. Keep on learning. We got a lot of amazing classes in our on-demand advanced functional medicine program. And I want to thank Dr. Chill again for sharing his experience, putting this together for us. And of course, as usual, I want to thank our media team and Jacob for making all of this happen and bringing us to you wherever you are. So thank you again, and have a wonderful evening, and take care. And we'll see you in the functional medicine program.